We're keeping an eye on COVID-19 cases as the season for respiratory viruses kicks into high gear. Today, the state health department reports about 1,300 new cases, 300 more than the daily average. New cases have gone up each day this week. Hospitalizations are climbing as well. Almost 500 people are hospitalized with COVID statewide. And VDH data doesn't say how old the people getting these new COVID cases are, but we know between COVID, flu, and RSV, a lot of children all across the country are getting sick and going to the hospital.
That's right. Hospitals in many places are close to capacity right now. ABC's Reena Roy shows us what it's like.
Coast to coast, many hospitals feeling the strain, with some of America's youngest flooding healthcare facilities.
We are earlier than usual in having a situation where our beds are full. Our respiratory unit is full.
The spike in pediatric patients blamed on a perfect storm of viruses like RSV and the flu.
What we're seeing right now is all of these respiratory illnesses hitting at once at a time where many pediatric emergency departments and community emergency departments were already dealing with fewer available beds, and it's combining to create a perfect storm.
Children's Health in Dallas saying this past week they had 313 patients with RSV compared to 2021 when they had 76. Pediatric hospital beds in 9 states and Washington, D.C. already above 80% capacity. 5 states, including Texas, at 90% or higher. In Indiana, Emily Berkshire says her 7-month-old was rushed to a pediatric ICU 4 hours away because it was the closest open bed.
It was the scariest thing knowing that there was no rooms available and seeing a baby that sick and having a hard time breathing.
Utah mom Sarah Miller says when her baby was diagnosed, her symptoms worsened at an alarming rate.
In probably the course of 2 hours, she'd gone from being our normal baby to she was on a respirator.
Doctors worry hospitals could see even more of an impact as we move into colder weather.
I'm worried that things are going to get worse. We'll see the rise of respiratory illnesses continue, especially as you add in influenza and COVID into the mix.
RSV can be especially dangerous for infants with small airways. Doctors say parents should know the signs of respiratory distress like flaring of the nostrils, fast or short breaths, or a change in skin color due to a lack of oxygen. Reena Roy, ABC News, New York.